Dialogue with a Doctor, featuring Southwest Florida's leading physicians.
Welcome to Dialogue with a Doctor. If you've not been on our show before, we welcome you back. This is a show where we talk to experts in the field in medicine, and tonight for this show, I should say, we have Dr. Raymond Phillips, a practicing gastroenterologist in Naples, Florida, and we will be talking about the treatment for hepatitis C. We've already spoken in another show about what is hepatitis C. So why don't you tell us a little bit about yourself first before we get on to that subject?
Okay. Well, I'm a board-certified gastroenterologist, and that represents graduated from and went to Princeton on an Army ROTC scholarship, went to medical school, Washington University in St. Louis, was selected for gastroenterology training at Walter Reed. Did that training for 2 years, but first I did an internal medicine residency at Jefferson Hospital and was chief resident there. And then after I concluded my gastroenterology training at Walter Reed, I was on staff for 2 years. And since then, I've been down here in Naples, and I work with Dr. Libersky, Dr. Marks, as well as Dr. Rivera, Hara, and Urbina. And we have offices in Collier County and Marco Island, as well as our main office in Naples and then in Bonita. And so, and we were talking earlier about what a board-certified gastroenterologist, that is what it represents, experts in digestive disease and liver disease. And earlier we were talking about hepatitis C and what is it, what causes it, and complications of it. And we were just beginning to start to talk about the therapy of it. And that's really quite a hot topic from our standpoint, in terms of because now the therapy is so effective. After years of disappointment, now we have therapy that's 99% effective. However, it's been mired in controversy because one of the first most effective agents, Harvoni, was selling for an easy $90,000 for a 12-week course, $1,000 a pill. And so it just got quite the attention because of that. And as a result, there was the company was receiving a little bit of a negative publicity about. Now, I have good news to report that since that was first released a year and a half ago, the price of this medication has dropped dramatically as other competitors now have entered the market with effective alternatives. The first was the company Gilead producing Harvoni, and then followed now by AbbVie producing Vicurapac, which is now followed by Merck, which is a drug called Zepatier. And now Gilead has returned to the fray with their latest entry, Epclusa. And these drugs now are very, very effective in terms of 99% effective. But the exciting thing from patients' perspective, not only are they effective, but the price now with competition has become to really decrease. So now instead of $90,000, it's decreasing the range of $20,000 to $15,000, and the price should come down even further in the very near future as more competitors come out into the marketplace and compete.
So why is this treatment better than the treatment in the past? Had a very bad reputation. It was difficult, and patients still think this. So why is this better, and how is it different?
Well, the reason it's better is therapy in the past was involved, the backbone of it was interferon in conjunction with ribavirin. And interferon caused terrible flu-like symptoms that would last a duration of use of the interferon, which was typically sometimes from 6 to 12 months in duration. And it had such a bad reputation in terms of potential side effects that many patients who knew they had hepatitis C were on the sidelines waiting for better therapy to emerge over time. And many were frightened of the potential side effects of the therapy itself. Now, with the advent of these newer medications, last 2 or 3 years, the therapy is so effective, almost without side effects, that there's really no reason for anyone to hesitate in terms of being screened for this and to be treated if indeed they have this condition.
If somebody's been treated before and it wasn't effective, can they be treated with these medicines?
Absolutely. Now, in years past, we'd have failures, and those individuals were were somehow marked as saying, oh, you got a tough virus, and indeed they did, using conventional therapy of interferon. But now with these newer therapies, we're able to succeed in those individuals who failed previous therapy.
The reason I asked that, because the patients made that statement to me just this week that no, you can't be treated if you've already been treated, and I didn't know where that came from.
No, that's not true at all. It's not true at all, and the therapies really have advanced so rapidly, so quickly, that if someone's failed previous therapy, we can be very successful using current therapy. So, and that's part of the reason why the CDC broadened the screening categories to all baby boomers, basically those individuals born between 1945 and 65, is to have everyone screened for hepatitis C and not just those with potential symptoms or elevation in liver tests, which was with the strategy which had been employed before.
I noticed that the names of these drugs sound very similar to drugs for HIV. Is it because they're structurally similar, or is it just the naming that's similar?
Similar, many of them are the same drugs that are used with HIV. And it was the same strategy that was developed in the successful delineation of effective drugs for HIV that was used for hepatitis C. By understanding the steps in the manufacture of each HIV virus, we were able to develop effective therapy for each step. Same with hepatitis C. Now that we understand the different phases and the reproduction of the virus, we're able to construct therapies for each step. And then by combining them, multiple drugs simultaneously, you're able to get a much more effective cure rate. And when I say cure, I mean cure. Once that virus is gone, and cure is defined where no detectable virus 12 weeks after treatment is concluded. Once that virus is gone, it is gone. It has no place to hide if it's not constantly reproducing. So there's no reservoir in the body.
So I've heard different definitions of a cure. I was under the impression that the viral load had to be undetectable for a certain period of time.
Yeah, it has to be undetectable for 12 weeks. That's the Center for Disease Control criteria for cure. So you conclude therapy 12 weeks later, you measure the blood test again and cannot detect that virus, you're cured. And there has not really been an effectively documented recurrence of the initial virus. Now people can go out and get reinfected again if they go out and use contaminated needles, or in the context of this current wave of IV heroin abuse across many parts of the United States, and that's occurring.
And that has occurred?
That has occurred where people get reinfected. So even though you've been previously infected and have antibodies, as I told you, the antibodies are not effective for preventing a new infection, just because the virus changes so rapidly that it's able to mount and initiate successfully a new infection and not be suppressed by the immune system. Yes, it's an ominous development, but nonetheless, we've succeeded in terms of being able to find a solution with these therapies.
So Harvoni, is that the first drug of choice that you use? Or how do you choose the drug?
Well, formerly it was Harvoni is approved for use for those individuals who have genotype 1. And it's also been used for those people who have genotype 2 and 3. And that's its principal indication. Vicurapac, which is a production of AbbVie, is indicated for genotype 1. And then Zepatier, which is produced by Merck, was also approved for genotype 1. And then the last entry that was just approved recently, Epclusa from Gilead, is for all genotypes 1 through 6. Now some of these drugs, there's a drug called sofosbuvir, which is a component of Harvoni, has been used in various for treatment of 2 and 3 and genotype 4. So it gets very complicated as far as knowing which drug to use for which genotype.
And in looking at the drugs, because I have them written down here, they are combinations of multiple drugs.
So the name is just for ease of use, but each pill represents a combination of medications together. And we can go through the names, but basically the names don't really mean that much to most people unless you're using these drugs all the time. But the point is they're effective and they're safe. and far less expensive, as I mentioned.
So what is the in terms of working a patient up and then treating them, what is the beginning and what's the end?
Yeah, well, that's a, and that process used to be a fairly intimidating process, where before we would, if you found an individual that had, for example, an elevated liver test in the context of a physical examination that was done for an annual physical or for a life insurance physical, they would be told that, oh gee, your liver tests are high, there could be a problem, you better go see a liver specialist. Well, that's kind of frightening. Or alternatively, a healthy person might go to the blood bank and be told, we're not going to take your blood because there's something wrong with your blood. And that's pretty frightening. And they said, you better hurry and go see a liver specialist. And that's particularly frightening. So individuals come to us being told that there's something wrong with them, but they feel good. And as a result, there can be a lot of upset and anxiety. And when we see an individual with elevated liver tests, we do a number of different tests to find out whether it's a virus like hepatitis C, or whether it's an inherited condition, or there's some other abnormality like a drug-related issue or a toxin-related issue like alcohol. But once we do the appropriate tests, we're able to very accurately and quickly find out whether they have hepatitis C, and then find out what virus, how much of the virus is, a viral load, as well as what genotype. And once we have that information, then we can have a very good conversation about the prospects for curing them of the hepatitis C.
You were talking about, we were talking off camera about doing an upper endoscopy. That's part of the workup?
Well, and that reflects the consequences of hepatitis C. If you have ongoing infection with hepatitis C, now remember, these individuals don't have any symptoms associated with the hepatitis C. Many of them don't really recall when they were exposed to it. They might be, as I said, if they had a physical examination for life insurance and they're in their 50s, they might have been exposed in their teens when they were sort of young and dumb and so forth, and did things that were wholly inappropriate, but became infected and have had this infection for 30 years. And so in a 30-year time span, even though they had no symptoms, there's an opportunity with that chronic inflammation to lead to scarring that can lead to issues in terms of development of large veins in the esophagus. So typically, if we find someone with hepatitis C, we'll oftentimes do an upper endoscopy to see if there's any signs of veins called varices. As well, we'll often do some type of imaging of the liver to see if there's any sign of any liver mass, because with a chronic viral infection like hepatitis C, there's a higher risk of liver cancer. So we want to screen for that, and then once we've screened for that, we'll continue to screen for that every 6 months for many, many years. And then with an imaging the abdomen, we can see whether there's any accumulation of fluid or anything else out of the ordinary. Now there's others, rarer side effects, but those are the things that are our principal concerns.
So the scarring is cirrhosis of the liver, is what you mean by scarring?
No, yeah, scarring, when you have accumulation of it, means cirrhosis. Now in the past, people would sort of equal cirrhosis to liver damage from alcohol, but that's not really accurate. Cirrhosis is scarring from any source, and in this circumstance we're talking about hepatitis C. And then once you have that scarring, the interesting thing is we're learning that if you can prevent further inflammation, some of the scar tissue can actually be undone. And the liver can repair itself to a degree, so there's not as much fibrosis and scarring as there was once you have elimination of this virus. Once you have elimination of virus, there's a potential also after 2 or 3 years of the risk of liver cancer going down over time. And so there's benefits from eliminating this virus in terms of preventing further liver damage and liver failure, liver cancer, and the potential as far as bleeding.
So the liver can actually heal?
Yes, it's quite talented that way. and that was demonstrated previously with alcohol.
We did not know that. I mean, We were not taught that.
Yeah,
when I
no,
went to
and
school.
generally it was taught that, hey, once you had liver damage, it was irreversible. But now it's apparent, at least with alcoholic liver disease and increasingly with hepatitis C, that that's the case, that we can actually see some improvement as far as the degree of scarring that's present. Now, like a lot of things, once you reach a limit, if you have very advanced scarring and the whole liver has been severely damaged, you're not going to get full repair at that point.
Well, that's pretty encouraging that the liver can actually heal, and we really thank you for coming, and we want you to come back and teach us more. And we thank Dr. Phillips for coming and being on our show, Dialogue with the Doctor, and we want you all to come back and hear some more from him again.
All right, thanks, Greg. Appreciate it.